A diagnosis of laryngeal cancer raises hard questions about voice, swallowing, and breathing. The larynx is a short tube of cartilage at the top of the windpipe. It holds the vocal cords that let you speak. Doctors describe where cancer starts: on the vocal cords, above them, or just below. Hoarseness is often the earliest sign. A tumor board of surgeons, oncologists, and therapists reviews imaging and biopsy results to plan the safest, most effective treatment. For early cancers, surgeons often work through the mouth with a microscope and precise laser. No cut on the neck is needed. Partial laryngectomy removes only the diseased part through a small neck incision, preserving enough voice box for speaking and swallowing. For advanced cancers, total laryngectomy removes the whole voice box. The windpipe is brought to the neck as a permanent breathing opening called a stoma. Nearby lymph nodes are often removed at the same time, since laryngeal cancer can spread there. This is called a neck dissection. Hospital stays range from a couple of days for laser surgery to 1 or 2 weeks after total laryngectomy, with early rehabilitation starting in hospital. Speech therapists guide voice and swallowing recovery. After total laryngectomy, a small voice prosthesis restores natural-sounding speech for most patients. Recovery unfolds over months. Many return to eating normally by 6 weeks, with voice and daily life continuing to improve after that. All surgery carries risks. Bleeding, infection, swallowing changes, and long-term voice change are discussed openly by your surgical team. Stopping smoking, attending follow-ups, and completing any recommended radiation give the best chance of long-term control. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.